Are you over 60 and finding that your bladder isn't quite as reliable as it used to be? Perhaps you're making more frequent trips to the bathroom, waking up multiple times at night, or even experiencing embarrassing leaks when you cough or laugh. These issues can be disruptive and emotionally challenging, but here's the crucial truth. You are absolutely not alone, and there are many simple, effective solutions available. Today, we're going to gently explore common bladder issues that affect many seniors after 60. More importantly, we'll provide practical, actionable tips and simple solutions to help you regain control, comfort, and confidence. This isn't about accepting discomfort. It's about empowering you to live more freely, sleep better, and enjoy every moment without constant worry. 1. Increased urgency and frequency. One of the most common complaints is feeling a sudden, strong urge to urinate, often with little warning, leading to more frequent bathroom trips throughout the day and night, a condition called nocturia. This often happens because the bladder muscle becomes less elastic and can't hold as much urine as it used to. Consider Mary, 68, who loved going to her book club, but found herself constantly worried about finding a restroom. The sudden urges made her anxious and limited her outings. Her doctor suggested bladder training, where she gradually tried to extend the time between bathroom visits, starting with just 15-minute increments. Over a few weeks, Mary regained confidence and could enjoy her book club without constant worry. Simple solution. Try bladder training. Gradually increase the time between bathroom visits to help your bladder hold more urine. Also, avoid bladder irritants like caffeine, alcohol, and artificial sweeteners. 2. Stress incontinence. Leaks with coughs, laughs, sneezes. This occurs when activities that put pressure on your bladder, like coughing, laughing, sneezing, lifting, or exercising, cause small amounts of urine to leak out. It's often due to weakened pelvic floor muscles, which support the bladder. Imagine Susan, 65, who found herself avoiding social gatherings because she was embarrassed by leaks when she laughed or coughed. Her doctor recommended pelvic floor exercises, often called Kegels. Susan was diligent, doing them daily, and after a few months, she was delighted to find she could laugh freely again without fear of accidents. Simple solution. Strengthen your pelvic floor muscles with Kegel exercises. To do them, squeeze the muscles you use to stop urine flow or hold back gas. Hold for a few seconds, then relax. Repeat 10-15 times, 3 times a day. 3. Urge incontinence. Overactive bladder. This involves a sudden, intense urge to urinate, followed by an involuntary loss of urine. It's often related to an overactive bladder muscle contracting at inappropriate times. Robert, 70, would suddenly feel an overwhelming urge to go and often wouldn't make it to the bathroom in time, leading to frustrating accidents. His doctor explained it was his bladder muscle overreacting. Beyond avoiding irritants, his doctor prescribed a medication to calm the bladder, which, combined with bladder training, significantly reduced his episodes. Simple solution. Besides avoiding irritants and practicing bladder training, your doctor might suggest specific medications that can calm the overactive bladder muscle. 4. Nighttime urination, nocturia. Waking up multiple times a night to urinate can severely disrupt sleep and lead to daytime fatigue. This can be due to reduced bladder capacity, fluid retention during the day that gets processed at night, or underlying medical conditions. John, 72, was exhausted. He was waking up 3 or 4 times every night to use the bathroom, making his days a blur. His doctor advised him to elevate his legs during the day, to reduce fluid pooling, and to limit fluids 2 to 3 hours before bed. This simple adjustment helped him get more uninterrupted sleep. Simple solution. Limit fluids in the evening, especially caffeine and alcohol, a few hours before bedtime. Elevate your legs during the day if you notice swelling, as this can help reduce nighttime fluid retention. 5. Incomplete emptying and constipation. Some seniors experience a feeling that their bladder isn't fully empty, which can lead to frequent urges and even urinary tract infections. UTIs. Constipation can also put pressure on the bladder, worsening urinary symptoms. Eleanor, 75, often felt like she still had to go right after urinating and struggled with chronic constipation. Her doctor emphasized staying hydrated and eating more fiber to manage her constipation. They also suggested trying double voiding, urinating, relaxing for a moment, then trying to urinate again to ensure her bladder was truly empty. Simple solution. Ensure you are fully emptying your bladder when you go. Try double voiding. Address constipation by increasing fiber intake and staying well hydrated. Bladder issues after 60 are common, but they are not an inevitable part of aging that you just have to live with. By understanding the common causes and implementing these simple solutions, from specific exercises and hydration strategies to medication awareness and working with your doctor, you can significantly improve your bladder control, comfort, and overall quality of life. Don't let bladder concerns limit your freedom and enjoyment. We'd love to hear from you. Which of these bladder issues have you experienced? And what solutions have you found most helpful? Share your tips in the comments below. If you found this video helpful, please give it a thumbs up, subscribe for more insights into living well, and share it with someone who might benefit. Your support helps us create more content to inspire and inform you. Thank you for watching, and we look forward to seeing you in our next video.